Why are so many private practice medical professionals completely burned out? And what is the one thing you can do to actually fix it? You're not just a doctor or a dentist or a therapist or a psychiatrist or an orthodontist. You're a business owner. But if you're running your practice like a practitioner instead of a CEO, then I'm telling you, you're at risk for burning out. In fact, burning out is inevitable. By the end of this video, you'll know exactly why medical professionals just like you are struggling and burning out at a rate never seen before, and 3 very specific things that you can do to stop burnout before it takes over you. So let's watch the video and see what happens. Burnout in private practice for medical professionals isn't about working hard. It's about working the wrong way. In fact, burnout is never associated with hours worked. I've known medical professionals that work hundreds of hours a week and are never burned out. And then I know some medical professionals that work part-time and they are burned out and they are so sick of the work. Burnout is always associated with lack of perspective. You lose, why am I even doing this? And that's important to remember as we go through this whole discussion. Medical professionals that are running your own practice, when you're the owner, the biggest issue isn't just long hours. It's when you start doing everything yourself, or you're falling behind on technology, or you don't have the right people in the right place and helping you in the right way. And we're going to break all of these things down, but I promise if you can solve these things, you'll keep your perspective where it should be, and you'll love the work that you do. Problem number 1, doing everything yourself. One of the biggest causes of burnout for medical professionals is you try to do everything yourself. You are in the chair seeing patients. You are handling marketing or approving marketing, or sometimes writing the emails yourself. You are managing and approving all of payroll. You are stuck in the insurance claims. You are speaking to patients that escalate. By the end of the day, there's nothing left in the tank for you to do. Why are you doing everything yourself? Here, as a business coach, this is the metaphor I give to medical professionals when I want them to let things go. You have been trained, and I want you to think for a second as a medical professional, would you let somebody come into your clinic and give somebody a shot? Would you just hand them a syringe, untrained, and let them give a patient a shot? Of course you would. That would be insane, right? You would only let somebody give another person a shot if they were trained, if they were certified, if they knew safety protocols, all of those things. So why do you think you have the same level of expertise as somebody who knows marketing or sales or insurance billing or training? Why are you inserting yourself in all these other parts of your business? That's the same as you walking in with no training and just taking a syringe and doing it. Stop thinking because you're the owner, you know better. Learn to let things go. Follow the principle of Elsa on Frozen. Let it go. And if you will let it go and get professionals that are experts at what they do, you will prevent burnout and you will find a lot more success. Promise. Now, this is where coaching can come in very helpful for you when you work with the right business coach, not a mindset coach or a guru coach that's just trying to make you feel better, but an actual coach that creates structure in your business to help you let things go and gives you the right metrics to manage so you can run the business like an owner and not a practitioner. Then you're actually running a business in a firm and watching it grow as you let your people be successful. Problem number 2, the lack of technology and the lack of automation. I know you are seeing AI everywhere. You are seeing technology everywhere. And let's just own the truth. Your practice is not using the right technology. It's not. You're probably using Google spreadsheets. You're probably not texting enough. You're doing manual scheduling, outdated systems. You're using one thing for your EHR and one thing for your patient outreach. You're probably not sending enough emails. There's so many things and you're wasting hours every single day. The real simple is 3 things have got to happen. Speed to lead, meaning you need to be speaking to your patients within seconds. You need to have almost no wasted time between patient reception and insurance billing. There's such a bottleneck in insurance billing, and you want that to happen automatically and as fast as possible. And 3, remember, the most attractive trait in all of patient service is speed. It is not patient care or quality of patient care. And it doesn't mean you can do bad patient care, but speed is the most attractive trait that patients want. They've done studies that show that when people go to a restaurant, they will take bad food quickly as opposed to really good food delivered really slowly. Just be quick. And yes, you still need to be a good medical provider. You can't, make enormous mistakes for sure, but be quick. We live in a TikTok day and age where people have such ADHD and no patience for anything, and Prime Day is making us all want things right away. So be fast. And technology and AI will do this. And this is where, if you were working with the right business coach, that coach would help you install all of those pieces of technology so that you are fast. Fast in your patient outreach, fast in your patient onboarding, fast in your patient connection, fast in your patient rescheduling, fast in your insurance billing. All of those things would happen quickly so that your patients have the experience that they want. Everything feels like Prime Day to them. You do that, it eliminates waste, lowers your labor costs, and makes your patient experience better and helps prevent you from burning out. Problem number 3, not having the right team. So many times practices start out and you start to hire people around you that you trust and that you like, and they've been with you from the very beginning, but then as you grow and grow and grow, you start to outgrow those people. But so many times medical practice owners, even though you've outgrown those people, you keep them around forever. And the business is much bigger than they can probably handle, but you never move them or never let them go. And your business is now working around those people as opposed to probably doing the best thing for the practice and letting them go and bringing on new talent. If you want to prevent burnout and take your practice to the next level, you have to have the dream team. You have to have every person in the right seat doing the right things to take your practice to the next level. Think of it like a lifeboat. On a lifeboat, you would never tolerate one person who wasn't pulling their weight. You couldn't afford it. And yet I promise you, in your practice, especially if you're experiencing burnout, you have people right now that you're working around. You, because of maybe their technology expertise or maybe their sensitive expertise or something, you are doing things around them as opposed to addressing the problem head on. And that's you acting like a practitioner as opposed to a business owner, like we talked about in problem number 1. Solve this by getting the dream team. And again, this is where, if you were working with the right business coach, they would help you find, interview, and hire the right dream team. You would get the right job descriptions. You would get the right KPIs to measure and train the right people. Your business coach would help you train these people to be the very best people you've ever had. And these people would be getting training on the regular, just like you did to get your medical license. They'd be getting training in their position at such a degree, so they would be the people you always wanted. So now let's get back to the question. Why are private practice medical professionals burning out at an all-time rate, and how do you fix it? It is not by working harder. It's about working smarter. It's not this whole guru, just have a better mindset and smile about it. It's about running your practice like a business. Stop thinking like a practitioner and think like a business owner. Delegate and operate the right way. Get AI and automation in place in your practice and build your dream team. Do those 3 things and get with a business coach that can actually help you do those things. That's what separates stressed out, burned out medical practice owners and the people that are actually living the life they've always wanted when they started this practice. If you found this video helpful, please like, subscribe, tag it, share it with a medical practice owner that you know is suffering from burnout right now. We want to hear about it. And if you're thinking about business coaching for your practice, by all means, leave a comment below and we'd be happy to talk to you about ways we can help your practice get to the next level and stop you from burning out.